Coming up in today's video, guys, we have a really interesting case of surfer's ear. I'll explain what that is a little bit further into the video, but my name is Rhys Barber. I'm one of the audiologists here at Audiology Associates. This is actually one of Taylor's patients that we're voicing over today. And what you can see here is we've got this really hard skin layer. Now, at first glance, it did look like it was quite wet wax, especially with those kind of nodules all around the outside edge of it. But what we can see is it's actually really hardened up skin. Now, I think the reason that we're getting these skin issues is due to the surfer's ear. Now, surfer's ear is basically where the ear canal starts to lay down a lot more bone. So you get this kind of benign bone deposits that lay down, and it starts to form much deeper in the ear canal. It's basically as a result of being exposed to, they used to think it was just exposure to cold water, but now they realize it can be exposure to all types of different temperatures of water, and it's the evaporation effect that might be causing this kind of issue. So basically, as the skin starts to migrate down the ear canal, and it comes from the eardrum to the outermost portion of the canal, it has to sort of pass along. Sometimes you get things like anterior recess and all the lumps and bumps inside the ear canal. But if you've got really pronounced what they call exostoses, which are these large bumps, which we'll show you in a second, it's much more difficult for that skin to kind of migrate around them. And it does tend to dry out in some patients, and you'll get these sort of plugs forming like we've got here. Now, Taylor's tried to use a little bit of suction to break this down, but this is actually quite a tough old plug. And the suction isn't really loosening it from the canal walls. Now, what you will find a lot with these particular types of patients is that you'll get these blockages forming sort of over these lumps that you see in the canal in a second. And what's going to happen is it's going to grip from the other side, so it doesn't really want to come out easily. He's got a good grip there with the Rosen inserter, and we can see a little tiny bit of forward momentum there, but we're just trying to get behind it, just into that gap. Now, this is really difficult to do because you've got to try and get the Rosen inserter, which is this curved tool that we're using here with a very narrow point on the end, to try and get that between the wax and the canal wall without touching it. There's not a tremendous amount of gap there, and especially if when you're pulling in, you're not really getting just over that lip of skin and wax that Taylor's trying to get over there. You can see it, if he just presses down from the top, it's just going to fold that top section down. Really, we need to get beyond it. Or sometimes what you can do, which I think Taylor does in a few seconds here, is try a different tactic, which is to use it in the center of the plug. And that way then, if you've got a little ledge there, you can get a grip and start to pull this forwards. You'll see this is what he's doing here. And now you'll start to see that forward motion now, everything moving forwards. Look how that is perfectly formed to the contours of the canal wall all the way around as well. I do slow the video down. We do stop it so you can get a look at these exostoses when this comes out, because it is a really interesting case. I think you'll find they're more pronounced in the second ear canal than they are in the first, but you can really see those lumps and bumps in there. So you can see how this would become really difficult for a patient, especially if they get that wax blockage or skin blockages forming beyond those exostoses. You can see how that would be really difficult to remove. So it is coming away really well. Taylor's gone back to the fine end, lots of olive oil in here as well. Now this, you can see that whole outer section there is starting to peel away really well. Don't forget, guys, if you do enjoy the videos, you can always like, heart, share, follow and subscribe for us. And if you have ear problems yourself, check out the link tree in the description. You can always book yourself an appointment to come along and see myself or the lovely Mr. Taylor Green as well. So Taylor's just gone back to the Rosen inserter. It worked really well in the first ear canal. And this is what we can see, just trying to get beyond these sections and pull this forwards. There we go. See how the whole plug is staying together really nicely here. And back over the top again. There we go. All the way down. Now take a look at the ear canal here when we get this plug out. You'll see, you can even start to see the exostoses there straight away just beyond the Rosen inserter there. But you'll really see how pronounced these are. Look how big those are there. So lots and lots of exostoses, really tiny gap in the middle. Luckily, nothing forming the other